Namaste. My name is Dr. Praveen. I am working as a consultant physician at Citizens Hospital, Nallagandla, Hyderabad. Today, I am here in front of you to talk about dengue fever and share little information about it. As you all know, during the months of July, August and September every year, we see a big surge in cases of dengue fever. And as you all know, dengue fever is caused by a virus which is called dengue virus. And this virus is transmitted to a human being through a mosquito bite. Okay? And like any other viral infection, like we've known about COVID, which is a viral infection, flu and swine flu, that also is a viral infection. But these are respiratory infections, wherein you acquire this infection by breathing in air which contains the virus. But dengue fever is different. It's because of a mosquito bite which got infected with the virus, and the virus is introduced into your body due to the bite. So the symptoms of dengue fever would be somewhat similar to any viral fever. You can have very high fever, you can get chills, shivering with the fever, and more importantly, in patients with dengue fever, they will have severe body pains. Dengue fever is also called breakbone fever. So, as the name says, the body pains are so severe as if the bones are breaking in your body. Okay? So, patients can complain of a low backache, especially pain behind the eyes, headache, sometimes nausea, vomitings. Okay? This can all be symptoms of a viral fever, but if you have severe body pains with fever, you definitely have to get checked for dengue. Okay? And the test which is available for dengue, there are two types of tests. Basically, one is called a dengue NS1 antigen and dengue IgM antibody. NS1 antigen test is the earliest test which we do. So the test can be done anywhere from 24 hours after you've had fever to up to 5 days of having fever. In doing the NS1 antigen test, again there are two different tests. One is a rapid method and there is an ELISA method. The difference is the rapid method is less expensive, but the sensitivity is about 60 to 80%. Meaning if you test 10 people with dengue fever, there's a chance you might miss 2 to 4 cases. Okay? Unlike this, an ELISA method is far more accurate, but it is little more expensive. Okay? So dengue NS1 is done early, and if you cross 5 days after the fever, we generally tend to do a dengue IgM antibody, but that is done only by ELISA method. Okay? So your doctor will choose what test is appropriate for you depending upon number of days of having fever. Now, assuming that you had dengue test positive, okay? Everybody assumes that if the platelet count goes down, it may be dengue, and if the platelets are normal, it is not dengue. No, it is not correct. In the first 5 days, your platelet counts can be normal. So don't be misled into thinking that you don't have dengue fever just because your platelets are normal. Okay? So if you have the symptoms, the doctor does the test, the right method, the diagnosis can be made. And once the diagnosis is made, what about the treatment then? As you know, dengue fever is a viral infection. Unfortunately, we still don't have an antiviral drug against dengue virus. So the treatment is mainly supportive treatment or symptomatic treatment. There is no role for giving antibiotics in case of treatment for dengue fever. Okay? The less the medicines you use in dengue fever, the better. So what treatment do we offer? Like if you have high fever, paracetamol. If you get nausea, vomitings, we give medicines to help with that. If you get loose motions, we can give medicines for that. If you get tummy pain, we can give medicines for that. Many times, patients get a skin rash with itching on the 5th or the 6th day after you had fever. Now, this rash is not harmful. It generally settles down by itself. But if it is troublesome, we can give you medicines to help you feel better. So, there's not, as you can see, there's a symptomatic supportive treatment that can be done. But very important in dengue, and something which makes a difference, is avoiding dehydration. So once you're diagnosed with dengue, you should go on drinking loads and loads of fluids, which can include water, ORS, electrolyte powder mixed with water, fruit juices, coconut water, soups. Many times patients don't like to eat solid food, but it doesn't matter. You can try taking a lot of liquid. That will definitely help you. But despite that, if you are dehydrated, we tend to admit the patient and then give you fluids through the drip, the IV fluids, like IV saline, we give them. So dehydration is an important part and we should not allow that to happen. Okay? The next thing is the first 5 days of the illness, we call it a viremic phase where the virus is multiplying in your body. That's why you have severe body pains and high fever. After the fever settles down, which usually happens by day 5, day 6, the platelets start to drop in your blood. The reason why this happens is because the dengue virus tends to stimulate some antibodies within your body, and these antibodies destroy your platelets. Okay? Now they will go on destroying the platelets as long as these antibodies are there in your blood. Now usually this starts happening from day 4, day 5, day 6. And day 6 and day 7 tend to be the crucial days where we see a big fall in your platelet count. Or in some cases where there's a mild infection, you might even see platelet counts improve. Okay? So you all have to remember that your body makes platelets every day from your bone marrow. What is happening in dengue because of the destruction of the platelets, what is being formed is not enough. That's why you will see a low platelet count in your blood. And over a period of time, usually by day 7, day 8 of having your fever, these antibodies tend to get exhausted. Then the destruction generally slows down and eventually it stops. When that happens, your own body's platelets start coming up and then you recover and your platelet counts become normal. So that's what generally happens. So it's just a matter of time that we have to support you and your body and then wait for the antibodies to get exhausted and your own platelets start coming up and then you're recovering from the illness. So that's about dengue fever. And what is the range where we start worry about? That's an important question many people would like an answer. If there is a drop in platelet count of less than 20,000, 10,000, there is a risk of bleeding in the body. That's why if patient has such a low platelet count, we give platelet transfusions. And usually this happens when you're admitted in the hospital. Okay? So even when you give platelet transfusion, those platelets also may be destroyed by the antibodies in your blood. So it's possible you may require more than one platelet transfusion. Okay? But there are many misconceptions about misinformation about treatments of dengue, wherein people use all kinds of medicines, some papaya leaf extracts and all. And as far as my knowledge goes, I haven't seen enough strong evidence to support the use of these things. And platelets eventually come back and then they become normal. Okay, so it's important that you know the symptoms, don't get misled, don't make a diagnosis very late, or don't miss the diagnosis in the first place. A good qualified doctor can make a diagnosis very early and closely follow you up and admit the patient when required and then use the platelets when required. As the time goes by, patients do recover, majority of them do recover. Very rarely there may be complications like drop in blood pressures, bleeding tendencies. These are rarely happening, but majority of the patients recover very well. So I hope the information that I have given you today is of use to you, and I hope you don't make any mistakes when any of your friends or family members have dengue fever and take appropriate treatment. Thank you very much.